Public confidence in the Centers for Disease Control and Prevention, CDC, has plummeted, and fixing this trust deficit is now at the center of a major national conversation. Robert F. Kennedy Jr., current Secretary of Health and Human Services, lays out a bold plan for restoring faith in the CDC's mission in a recently published Wall Street Journal opinion piece. But here's where it gets controversial. Kennedy is not just criticizing the agency, he's taking direct action. And not everyone is happy about it. Kennedy argues that the CDC has drifted from its fundamental purpose, safeguarding Americans from infectious diseases. He attributes this loss of direction to decades of red tape, politicization of scientific guidance, and what he calls mission creep, when an organization's responsibilities keep expanding beyond its core focus. According to him, these issues have severely undermined both the CDC's effectiveness and the American public's trust. A pointed example Kennedy gives is the CDC's handling of the COVID-19 pandemic. He claims the agency's decisions led to widespread confusion and inconsistent policies. Think mask requirements for young children, the rigid 6-foot social distancing rule, booster shots for healthy kids, long-term school closures, economic hardship from lockdowns, and a preference for expensive, experimental drugs over more affordable treatments. The consequences, he says, were devastating. But this is the part most people miss. Kennedy doesn't chalk up the CDC's pandemic response as a rare misstep. Instead, he insists it represents a larger pattern of failure. He points to America's declining life expectancy and persistent skepticism among both healthcare professionals and the general public. For instance, only a third of healthcare workers received the full COVID booster in 2023-24. And fewer than 10% of children under 12 got boosters in the following year. Kennedy contends this proves most Americans no longer trust the CDC to prioritize their well-being. The conversation turns even more intense when we look behind the scenes. Kennedy expresses frustration with how the CDC spends its budget and allocates its staff. He notes that less than half the CDC's resources are dedicated to its main job, fighting infectious disease, and that only about 1 in 10 CDC employees are epidemiologists, a factor he links to the agency's pandemic shortcomings. Even as he voices sharp criticism, Kennedy expresses hope. He points out the CDC's robust response to a recent measles outbreak as proof that, when unburdened by bureaucracy and political agendas, the agency is fully capable of acting swiftly and accurately. Highlighting efforts by the Trump administration, Kennedy mentions the replacement of entrenched leaders unwilling to embrace reform, as well as new moves to root out conflicts of interest and bureaucratic inertia. According to Kennedy, the process of rebuilding trust is underway. He states, restoring public trust in the CDC has begun. We won't stop until America's public health institutions are once again dedicated to transparency, honesty, and service to the people. But here's where the disagreement really heats up. Kennedy's overhaul of the CDC has sparked intense backlash. More than 1,000 current and former Health and Human Services (HHS) employees have signed a public letter demanding his resignation. Their complaints center around Kennedy's firing of the CDC's previous director, Susan Monares, and his appointment of what they claim are political ideologues to key positions. In addition, a group of 9 former CDC directors published a letter in the New York Times, fiercely arguing that Kennedy's leadership poses a risk to public health, accusing him of minimizing the importance of vaccines and relying on insufficiently tested treatment options. So, is Kennedy's crusade to remake the CDC visionary reform or reckless meddling? Are these changes restoring trust or eroding it further? This debate cuts to the heart of how Americans want public health to work and what they're willing to tolerate from the leaders in charge. Are Kennedy's critics overreacting, or are their worries justified? Share what you think. Is this the transformation the CDC needs, or is it a step too far?